I think there's a few key things. One of them is people being more involved in their self-care and help through apps and various other things to understand how their behaviours influence their health outcomes. I think there are a number of medical devices in terms of understanding when people have taken medicines that can help. So people, particularly as they get older with dementia, perhaps things find it a struggle to understand if they have taken their medication or not. So there's some telecare devices such as carousels, and there's even the smart tablets now that sort of I think we'll see becoming increasingly popular. And I think in general just greater access to information across the internet has helped understand. So some of the forums where people can discuss side effects and things like that and see if they're common and get support from their peers, I think will be helpful. I think there are. I think one of the biggest things is going to be interoperability and how systems talk to each other and how we can exchange information across organisations more easily because of some of the standards that are coming in place, standard categories and names for medication, for example. A big part of that is going to be will and culture. I think part of the technology can provide some of the solution, but a lot of it is about a willingness to share and a real drive to provide high quality patient care. And with that, I think you will see opportunities for technology, much broader than just pharmacy, across the whole spectrum of health and care. I think we're already seeing examples of places that are really making great strides in terms of sharing information, both with professionals across organisations and also with patients. And I think what we need to do is see some of those schemes expand. I think part of that will be eased because I anticipate as we go forward there's going to be an increasing need for systems that supply the NHS to conform with certain standards, and that makes interoperability a bit easier. I think a lot of these things really, again, come down to the drive and determination of people locally to want to see it happen. And I think we're seeing a lot more in terms of patient pull, because from a digital world, for the way people interact with other services, they're expecting certain things of the service and how they interact with the service. And so we'll see patient pull driving more personalised care and use of technology. We'll also see the need for integration as we move to broader footprints, as information follows people around their pathway. And the two together should really enhance things and change the way we deliver for the better.